All right, man. So I know we've got a lot to cover in a short period of time. Do you want to go ahead and take the lead, Aya?
Sure. I'll maybe just give the agenda, and then if agreed, then we can kick off.
Yes, please.
All right. So thank you all first for joining. We have about 13 participants, so that's a good turnout. So basically what I'm proposing is to first start with a continental overview, what we're doing at the African Union and what's the state of COVID-19 in Africa, and then have a briefing from different countries of my lead sisters on what's the situation in your countries, basically focusing on what are the measures that have been taken, preventive and responsive measures that are working, and if any challenges as well. And then we move on to brainstorming around three main questions of the consultation. One is on communication tools, one is how to mobilize youth and civil society, and one is how can we share best practices and learnings. And then we can wrap up with some action points moving forward as a group.
Okay.
Does that sound agreeable?
It sounds agreeable.
Sounds good. All right.
And thank you, Gloria, for stepping in and facilitating the meeting in a short notice. Not surprised. A group of young leaders.
Happy to help.
We have on the call Elvis, a volunteer on my team who will be helping taking notes. But also if anyone is taking notes, especially of the highlights, please do if you can, and then share it with Elvis so we have a good report. So without further ado, maybe I'll just kick off with a briefing. This is an hour call, so this call will end automatically in an hour. So let's just make the best of it. That's how Zoom works. So as of this morning, 10 a.m. Addis time, Africa CDC reported that 47 African countries have a total of 5,255 cases of COVID-19 with 172 deaths and 371 recoveries. We have also 31 border closure in Africa, and we have 12 international air traffic closure. So in the African Union, we have the Centers of Disease Control and Prevention leading the response on the pandemic, Africa CDC, which is a specialized technical institution of the African Union, established to support public health initiatives of member states and strengthen their capacity in health detection, prevention, control, and respond to disease threats. Since February in Addis Ababa, the African Ministers of Health were convened and they agreed on a joint continental strategy and put in place a task force. And as a result, actually, of implementing that strategy, I'm sure you've heard about the relief initiative by the Prime Minister of Ethiopia with Jack Ma Foundation, founder of Alibaba. Over 1.5 billion diagnostic test kits have been distributed across the 55 countries and hundreds of tons of infection prevention and control commodities. And so this week, about 40 countries have already received equipment, and it's evenly distributed. So about 20,000 diagnostic test kits and about 100,000 medical masks and other protective suits and face shields and other things. So just quickly on Africa CDC, it holds weekly updates with national public health institutes across Africa and posts twice a day an updated map of stats. So I encourage you to share from their social media the official information. And also Africa CDC does training. So they train hundreds of experts in prevention and control, enhanced surveillance, infection prevention, risk communication, and so on, and initiated a design of online portal with training materials, online courses, online case studies to support evidence-based care of COVID-19 patients. And we have now 43 laboratories from 40 African countries that have also participated in trainings. So the main goal now in Africa is to rapidly detect, contain, and minimize harm, but most importantly, to break the transmission chain. So there have been a lot of measures taken by governments, testing, tracing, quarantine, curfews, like lockdowns, and preparation has been the mantra of the African Union, because it's so important to avoid numbers exceeding what the system can accommodate. The main challenges that we've seen, there are many, but I look forward to hear from all of you, but two maybe main ones is the denial that this virus exists. So many people are not disciplined with the measures and they just go about their lives and not take it seriously. Or on the other extreme, the fear to the point of panic. And there is also maybe a communication challenge, and underneath that, the trust between citizens and authorities to collaborate. And that's why we see less individual collaboration and more government enforced measures. So that's why we're doing this virtual AU Youth Consultation series with young people to form a kind of collective youth response that can address these challenges, because we're the most placed to act and to engage our peers and find those trusted messengers who can influence the needed behavioral change in our communities. So I think we can be a bridge to help accelerate response and responsibility for young people. Just an overview, and I look forward to hearing from you and your ideas and how can we play our part as also MILEAD sisters in this difficult time.
Okay, thank you, Aya. That was very, very detailed. And I totally agree that there needs to be more stringent restrictions to mitigate the spread of the COVID-19 outbreak. And currently I live in Saudi Arabia, so I'm not in Tanzania where I'm from, because I think last time I checked, there's only like 19 cases in Tanzania currently, but we did have our first death reported a couple of hours ago from the COVID-19. And somebody, I can't remember the name, but they're around 49 years old. But the measures that are being done in Saudi Arabia, because we have over about 1,000 cases over here, have been very stringent, and they have been working. So everything from implementing lockdowns to curfews to closing down all public spaces to finding people who are caught breaking the curfews, including jail time, paying a significant amount of money, as well as taking measures to make sure that the information that is disseminated among the people is actually factual. So there are preventative measures that have been taken place or that are being put in place by the government to ensure that nobody's spreading false or false information, which of course will evoke pandemic. So I am curious to hear what, for those who are in Africa, what are some of the measures that have been taking place? Because I know South Africa is the epicenter for Africa with the most cases. But for those living elsewhere, is the government currently doing more? Are the people taking it seriously? Is information being, is information about this virus reaching the necessary places, especially the rural areas? So that's a question to the group.
Can I speak?
Yes, please.
Okay, my name is Ayo. I work with Amanda at ALA. I think.
Hi, Ayo.
Hi, Amanda. I think, South Africa is the epicenter, but with regard to, I want to speak to what you just said about rural areas. I do not think that the information is being propagated effectively in the rural areas. And I mean, it's for many reasons. I don't think people in rural areas do not have I don't think they have the resources that we have in the more urban areas. So I think we need to start thinking around how to reach people within the rural areas better. We've seen videos of people in townships and rural areas basically not taking it seriously, thinking that it's an actual myth. And now, as at today, we have some cases in some townships already. So now, even though it's the epicenter, it doesn't seem like we're doing enough. It seems like most of the information is dissipated via social media. Um, I'm not sure about TV because I don't really watch TV, but I haven't really seen
Did we lose her? I can't hear.
do not think enough information is also being propagated as well in Nigeria. So I think this conversation about how we can communicate more effectively to people, I think the principles of because I'm a medical doctor, so the principles of how we communicate information to patients, meaning the language that they understand at the level at which they understand, needs to be applied in this scenario as well, because this is for everyone. I don't know if someone has something to add.
Well, just following up on what you were saying, I think I'm in agreement in terms of looking for the most effective ways to communicate with people in the rural areas. So I just saw Grace's comment on the chats, and I'll address that just after this. But I do think that so right now in Botswana, what they did is, particularly for rural areas, they're looking for ways in which they can communicate to the people in a way that they understand. First of all, the local language is the one that is being used when they're communicating and they are dispersing digital data or whatever data that they're communicating through. They're making sure that it is always being communicated in Setswana and not English. The second thing is they're using the local chiefs in the small villages and in the small towns where chiefs are still really the ones that are more prominent than probably in the cities. So they're trying to disseminate the information in what we would call a khotla. I don't know what the English word is, but yeah, a gathering, a community gathering. So they're doing that, and then they're inviting health practitioners to come and talk at those community gatherings. That way, if the chief sanctions it, people listen to the nurse, as opposed to if the health worker is the one that is actually communicating it. So it also depends on who is looked at as authority in the community, and they may be using them as opposed to the doctors, the president, or anyone else. Like in the local community, what is the structure and who is the person that people listen to, and those are the people that we've been targeting. If it is, for example, a religious figure of theirs, and that's the person that we're trying to get to educate, and then they're the ones that are disseminating it into the community. So I suppose it's a question of figuring out if we are actually actively looking for innovative ways to communicate to some of these more marginalized communities, or if we're assuming that all types and forms of communication span across all income brackets. And so that would be my contribution. And then the point that Grace made about whether some of them can't sustain staying at home, I do believe that that's something that is very true for some. In the most rural, I don't think that's a problem. If I could be wrong, but in our villages, for example, people live in the villages, work at home anyway. They work on their farms, they work on their lands and stuff like that. But in the case of perhaps maybe the township people who work for the people who stay in your more urban and suburban areas could be the ones that are really struggling during this time. And how do we make sure that we're not insensitive in our communication, as much as we do want them to stay at home? What alternatives have we already put in place to cushion the issue of income?
Well said, Amanda. Thank you so much. And I love the fact that Botswana is using the local chiefs. in the villages to send out the information to the people, because the way Africa is set up, it is unique in terms of its structure. And in terms of, I think the best way to reach the people is by first identifying the leaders in different regions and different villages, and then utilizing them by either one, whether it's training them, talking to them, giving them the information, and then having them translate it in a way that would make sense to their people. And as another point I would like to bring up is using China as a case study, because the cases in China have significantly gone down, and the measures that they've taken, though were very militant, did work. So either by some of the measures that they did implement, do you think that Africa needs to look at China as a case study to learn what to do and what not to do, as well as in other places, other countries where they have control of the spread of the disease as well?
I think in terms of China, I think we can take some lessons from China, but not all of it. Mostly because China had resources that we don't necessarily have. For instance, when they instituted a lockdown, they ensured that everybody was well taken care of and there was very minimal loss of income. They were able to build hospitals in a few days, and that was that. But I think we need to start looking at our context and almost modify per context. For instance, recently, I think it was this week, in Nigeria, there was, they basically turned stadiums into makeshift hospitals. And they put like large tents, those kinds that you have at weddings that almost look like a building. And then they've just put like a whole lot of beds in there. And they mobilized the private sector to actually donate towards this. So we have isolation centers that are actually in the middle of like a stadium. I think that's something that's doable, rather than like building like an entire hospital. In terms of supporting like poor people, like what China did after, actually they supported everyone after the lockdown. I'm not sure how possible it is. I think one thing that we can realistically do is see how we can have we can mobilize like a fund. I think each country probably has a fund where you can donate to. I think my question to this group would be, is it more effective for it to be centralized or decentralized? Do we have a fund per community, or do we have like a central one for the country? Like, how would it work like more effectively? Because for instance, if there's a fund in South Africa, I'm not sure if it's going to reach members of like the rural areas in the Eastern Cape, for instance. Are they going to do anything for those people, or are the funds going to be focused in like the urban areas like Johannesburg? So I'd love to hear your thoughts on that. But I recently also found an article that was written by Raj Panjabi, who is the CEO of Last Mile Health, and he spoke about the lessons that Liberia learned from the Ebola crisis, and how we can use those lessons to help in the current crisis. And I think that's something that we can look into. Yeah, I think it's a very, very helpful article. I think it's more because Liberia is a low-income country, low to middle-income country. They have very few resources. They have very few healthcare workers. From my understanding, they have, I think it's less than 2 doctors per 1,000 people. There are very few doctors, very few healthcare workers. And one thing I want to add is in terms of reaching the people in the rural areas, in addition to using like the chiefs, we can also use community health workers. I saw in your brief, you spoke about unemployment of young people. This is a way of deploying like young people that are unemployed, training them for this specific purpose, and using them as community health workers just to disseminate the information, and even to conduct like, if there's testing and tracing that needs to be done. That's something that they can do because they belong to the community, they speak the language, they're trusted by the community. And so it's easier to propagate like information that way. Another idea that I think that we can look into I think people in the rural areas, even if they don't have an internet-enabled cell phone, lots of them still do have a cell phone. So how about, can we disseminate information using USSD codes and SMSs? Is that something that is feasible? I think that would be a cheaper way of reaching such people, and it would also be an effective way of reaching people both in like townships and rural areas.
I would like to come in. Hello?
Yep, go ahead, Grace. We're listening.
Thank you, guys, and thanks, Aya, for the meeting. I have written a couple of things that I would like to share. First, to your question, for example, in Uganda, yesterday we went into a total lockdown, which means everybody has to stay inside except for specific designated offices, but also except for if of emergency cases, and a lot of permits have to come to like the presidential or representative within the district level, which means that when we talk about communications or youth mobilization, it is not mandated for any young person to be on the streets, which means that, of course, the point of intervention to different countries have to be different. And was trying to ask also myself some of the questions of what is the availability to beef up like the citizen messaging in such countries, you know, where there's an imminent total lockdown. What platform then are used? One of the things that at least governments will a repeated circumstance that is going to happen is government insisting on only media houses or specific communications that come from national CDC offices. So it also puts the questions of what would be the visible or alternative or contributory means that such initiative on advocacy for the pandemic would come across. And then it was also a question of maybe we could map, or I don't know if your team has already done in terms of mapping out all community radios that exist, possibly on the continent or within our countries. And then there's an opportunity of intervention for organizations like Internews that excel greatly in that. And I know for sure they've already started on messaging on CD, on the pandemic themselves. But then it's a question of what is the new niche then that such an initiative would add to what's already existing for potential collaboration and partnership with us and our institution. And maybe a point of entry could also be just map out youth mainstream platforms that exist to be able to also reach out to a lot of young people that not have access to internet, but also envisioned internet shortages as everybody stays home. Part of the possible collaboration or point of interventions for our collaboration that I kind of see could be built on what is the new thing that we are bringing into what's already happening outside or within the framework of youth. And it's great that you've also mentioned that there's already existing youth unemployment and issues of insecurities and the human rights violations before this pandemic. And it's a question of now, what is the status quo? What is the projection of for example, if this scenario gets long term, which is something that is, I don't think it's clear from any of our governments on what is the plan. And if this scenario also gets to the worst case issue, these are two questions that is quite not clear, even from our governments. Even in Uganda, it's not clear We know the extension is just done within, the total lockdown is done within like specific 14 days, but that's not how the diseases work. I think Ayo could tell us that. So it's a question of like could also be a point of intervention that maybe we come from those specific criteria. And then also a question to you, is there a vision point of entry of our collaboration beyond advocacy? If that is also an element that you'd be interested in, because then it also tap into our conversation that we had yesterday, that maybe Amanda, you could summarize it for us, if you don't mind. I just thought I would, I would talk about these things. Thank you, guys.
Thanks, Grace. Gloria, do you want me to jump in with a summary of what we discussed yesterday?
Yes, please. But just before you do that, I just want to highlight just one more question that maybe you could also possibly include in your summary is how can we mobilize and organize the youth and the non-governmental actors to play a key role in the prevention of the response and the transformation of the crisis? Because we kind of already touched on a little bit about how we can, how the communication tools, how we can structure countries. And so we talked about the Ebola and the Ebola virus in was it Liberia? So can you talk a bit more about that, Amanda, if you do have information about that, as well as Aya? And I know we talked a lot about a lot of different things, but some of the things I'm also hearing is that, you know, there is a lack of resources, that we do need to target and talk about the mindset of the people, and also about the inadequate health care infrastructure. So those are some of the issues that I feel like are being highlighted, and I think is one of the main issues that we can say collectively in the African continent. So I'm just going to put that out there and let you go ahead, Amanda.
Question, that very first question, at the moment I'm not too sure what the response could be in that space right now, but I will talk through some of the stuff that we were thinking about in a little bit more detail now. So one is we wanted to almost frame this conversation that we're having right now in identifying themes that we collectively could work on brainstorming specific interventions and initiatives and ideas, and also things that we felt like as a collective we're already working in our different countries and in our different roles, so that if there's any type of agreement that we make here, we are able to actively be able to actually disseminate that information depending on what the theme is. So yesterday we identified 4 themes that we felt strong about. So the first one was around youth unemployment. Second one was looking at the implications of our health system. The third one was Africans in the diaspora, and then the last one was implications for COVID in education. And we wanted to almost start thinking through what kind of communication do we want to frame in these spaces, but also what type of interventions do we want to start suggesting for post-crisis, so that we are actively also thinking through how we're going to tackle some of these issues that were actually already existing but are being exacerbated by the COVID-19 virus. So the first one was around youth unemployment, just identifying that it was already on the rise and a very fragile area on the continent. And because people are getting retrenched and economies are quite hit right now, we're going to need to think through what alternatives, are there for young people. Just to give you an example, with my country, for example, diamond is the biggest exporter that we rely heavily on. And as of yesterday, we stopped sales for diamonds as a country for the time being. And what does that mean for the economy? Also, what does that mean for people whose jobs depend on the mining sector in the country, particularly on diamond mining and sales of it? So there are issues right now that are being asked, and I think case by case in every country around, okay, if we're already retrenching people now during the crisis, what's going to happen to jobs post the crisis? Particularly, I think for young people, they're going to be even more vulnerable. So how can we work with existing actors in this space? And yesterday we mentioned some key people who are already working in this space. We talked about Harambe, we talked about the MasterCard Foundation, we talked about what African Leadership Academy is doing, and we just talked about looking for ways that we can collaborate to figure out how to, one, facilitate the creation of new opportunities, whether that is alternative opportunities in the freelance space, remote working space, self-employment, whatever that looks like, and be able to really come up with communication to young people on what they can empower themselves on during this time and also post this, just so that we're also thinking through stuff like that. We talked about working with national youth councils to figure out what communication should be put in place on recommended policies that will promote thinking through structures that will gainfully employ young people in our different governments, and how that communication can start happening now. And then regarding health systems, I think Dr. Ayo touched a bit about it, but we have talked about how this pandemic has really highlighted to us how fragile our health systems have been already, and where the lack of financing in the health sector has been taking a hit. And I think for us, we were also quite worried that because our continent is already dealing with comorbidities like HIV/AIDS, TB, particularly here in SADC, I do think that we were quite concerned that this is going to hit us hard. What does that look like for young people as well? And how are we communicating to people who already have comorbidities about how to be taking care of themselves during this time, and why it's actually super important that they actually take the messages more seriously because their immune system is more fragile. So we talked about the education space. We were quite worried because currently, this has highlighted to me personally, something that I had been very ignorant on, how schools have closed in most African countries. So I'll give an example of Botswana. We are closed till August for our basic education. I'm not sure about universities. What does that mean for our children during this time who are in public schools? So private schools are offering online education, but what does that look like for public schools? We don't have a digitized curriculum, first of all. And then secondly, even if we did, we don't have the infrastructure that supports online learning in the rural areas and the villages. And if we were to solve that, we would still need to figure out how we educate young people on using these platforms in their gadgets. So I think the idea of, at the moment, using a more temporary fix of using radio stations and perhaps even television programs might be a better option for this. But long term, we do want communication to be given to our governments that we do need to intensify education around ICT and using that for education, but also talking through digitizing national curriculums, and then also training our local public education teachers on how to use technology for teaching. And I think that was something that we wanted to communicate And then the last thing was around we also talked about sexual reproductive health and how the pandemic right now is actually impacting sexual reproductive health rights and issues in women. So we wanted to see how we can actually put that in as well as we communicate whatever we end up communicating. And the last one was the role and influence of the AU and the diaspora to address issues that are being faced by young Africans in the diaspora. I think there was a point around taking note of the stereotypes that manifest about the diaspora and how these are transferred into the foreign affairs offices of Africa, as well as the AU diaspora office. So that was something that we also talked about. Essentially, I think for us, these were the key things that we wanted to zone into, because the conversation can be quite big and large, and we just felt like we would be more helpful in these areas, particularly if your hope is that after this we disseminate some of this communication and information. If I missed anything, anyone else can jump in.
Thank you so much, Amanda. We do have a limited amount of time left, about less than 15 minutes left. There were a couple of questions and points that people did bring up. There was somebody who wanted to share a little bit about, I think Donors for Africa wanted to share about educational lessons that they're implementing in their country and how we can use that. So can you go ahead and share with us very briefly if you can?
Yes.
Hi, Chidi.
Hi, ladies. Well done on the fantastic work everyone is doing so far. I know this cannot be easy. Just to get right into it, I had wanted to, first of all, mention on the you had talked about what we're doing locally is that we have included educational information and like full-blown curriculum lessons on TV stations and radio stations, diverse TV stations and radio stations. So even children from public schools could tune in at a specific time. Hopefully, if there's electricity, they can tune in at a specific time to watch educational learning programs as approved by the government, those preparing for their WIEC exams prior to COVID, and other people who were preparing for key examinations. That's one thing I know that we've been doing locally that has worked. And then I had also thought to mention something that has been happening more frequently. I mean, I've had a couple of friends in the medical space who are going through this COVID-19. They have the virus and they're dealing with quite a lot of real issues, and that's the issue of discrimination. I don't know if this will be piling too much on the AU, but I think it's also something we need to mention, because I worry that because people are afraid and do not really understand the implications of the illness, the people who do have the illness are not being given the kind of treatment that they deserve. It's almost like the isolation centers are areas where they can just be tossed into and they will be there and wait to die, because healthcare workers are afraid to come in. And I mean, people have been complaining they've not been fed for some hours, they've not been attended to by health professionals. A man is actually insisting on taking his daughter home, and he would rather prefer she dies at home than die in some isolation center without being attended to. So I don't know if there's a way we could include this in the conversation around discrimination, especially for young people who are faced with this virus and they don't have a voice, they're not rich and popular, they're not the musicians, they're not famous, they don't have anybody in government that can be, we tweet about it, and then everybody all of a sudden wants to put their voice because they are very popular. So I really felt that it's something I should mention in case we may want to consider drawing attention to the discrimination that's currently happening for people who have the virus and have not been attended to. Thank you.
Thank you so much. Go ahead, Dr. Ayo. Can you just share very briefly some of the points that you were talking about in the chat about the health infrastructure?
Okay, I just wanted to, can I just quickly just ask, I think it's Chidi. Yes. I just wanted to just add if this has to do with inadequate PPE at health facilities for healthcare workers. So they know that they're not protected and they refuse to like go, near any patients that have COVID. Okay, my country has made quite a lot of donations, both individuals and professionals. They are equipped, they have the outfits. I guess it's just the fear of going into the room and providing the healthcare services to these people who are living with the virus at the moment. That's been it's been happening consistently over a period of time now.
Okay, cool. And Gloria, just what I've been sharing, I shared a link on the stadium that was centers, whatever the case may be, have like a little covering over it and like convert it into an isolation center. That's something that is I think is doable and something that we can do, like we can mobilize, I think, even the private sector to assist with. Then the other thing I mentioned was about cardiovascular health during lockdowns, inactivity, poor eating habits. If it carries on like that for long or protracted periods of time, after the lockdowns, we might be seeing an increase in thromboembolic events. So basically like clots in the peripheries, like their legs, and maybe even pulmonary embolism, MIs, things like that. And I think that's something that young people can actually use, like their social media and stuff, to actually propagate the right message on how exactly realistically can I keep myself active while remained in a confined space for a protracted period of time, and how do I eat properly during the lockdown. I don't know if there's anything else you wanted me to share on.
No, that was about it. Thank you so much. Just to remind everybody that the call will cut off automatically at 4 o'clock. So we do have a very limited time. So I just want to make sure that these last few minutes, is there any burning issues, things that we haven't touched on yet, ideas about how we can mobilize and organize the youth to play a key role in the prevention and of this response? Anything about the best practices that we can learn from other countries, people want to add on to that. As I said, Dr. Ayu shared a lot about Ebola already. Anything else anybody wants to share according to that? So if there is anything else that anybody wants to share, please go ahead now. The floor is open. You do have a few minutes.
I don't have anything to share, just letting Aya know that she may have to do a second session of this, because like Grace just wrote, we haven't even gotten to the commitment part and the agreements.
Yeah.
So yeah, sorry, Aya, go ahead.
Yeah, maybe I can just summarize, since we don't have much time. These consultations meant to be very, very short and action oriented, and I think there is a lot of wealth of experience and sharing in the group, and I agree with you. We might need a second one to dig deep into maybe formulating the solutions, because now we know the challenges. So if you can give me just a few minutes to give an overview of where we at and what we discussed, and maybe how we can move forward. And then also please keep sharing on the chat if you have particular commitments. We'll make sure to put all of these in the report, and then we will have a follow-up on that. So I think from what I'm hearing is that the collective response is key, and that's what I'm hearing from Amanda, Dr. Ayo, and many sisters who shared. The way we're trying to also focus these consultations on 3 phases: the preventive phase, the affected communities, and the post-crisis needs. And I think in the preventive phase, many people mentioned communication tools around community radios, using chiefs, religious leaders, most importantly, building trust between people and government by using these kind of messengers to communicate the pandemic, communicate messages around social distancing and washing and so on. I think also political discourse is important. I saw someone mention about Tanzanian president saying that it's okay for religious leaders to, or religious mass gatherings. And I think that's important as well, to make sure that our leaders are also following these measures that we're putting in place. And I think even with MILEAD, for example, Dr. Ayu or other experts in the group can guide young people and can do a webinar, for example, a MILEAD webinar that the expert in the group can lead. This is something immediate that MILEAD can do. In terms of the AU, we're doing a lot of communication from Africa CDC podcasts to awareness cards to helplines. We literally did 55 helpline cards to be circulated in countries' languages in French, English, and Arabic. So we just need a better coordinated effort to share the communication from the official source. For us, we're trying our best to do that, but we rely on you to also circulate that information. There is a lot of overwhelming information sharing right now, but I think the World Health Organization and Africa CDC are the main source, and then we can use that and make it creative based on our context and our local language and so on. And then the second phase of affected communities, I would say the most important right now, I don't know if it's been mentioned maybe once, but testing is so important, and mobilizing partners and these funds to be directed towards testing is so important. At Africa CDC, we provide kids around, I think, 1,000 tests for any country that reports cases, and working to procure emergency medical equipment stockpiles. But I think we need more. So I see a lot of fundraising happening, but we don't know where does that fundraising go. I think learning from China's study case, testing is so important. The second thing is isolation to break the transmission. But as many people said, there is a lot of infrastructure challenges in Africa. And so like Rwanda the other day published something about door-to-door distribution of essentials and foods and access to electricity. That's essential. Support for small and medium-sized businesses during lockdowns and so on. I think fundraising should also go into these kind of response. There was an idea around mapping out African youth initiatives. This is something we could support with. We can create a webpage, a hub of African sources, youth-led, community-led initiative, government effective measures to be all in one place where people can share and replicate. That's something that we could also do and crowdsource. Happy also to support you hosting national virtual consultations with these actors you were mentioning, national youth councils, government, other partners. I think these need to happen at the national level as well. And each of you as MILEAD sisters can lead these consultations. So we're happy to support that. And then the last phase is the post-crisis need, which is the advocacy part. And what we're trying to do with these consultations at the end to form a collective youth and civil society corona response group. Not just for now, but for later, because the amount of damage and impact on Africa will be huge. Socioeconomic needs, youth unemployment. We need to transform our health systems and infrastructure. One initiative we started is the African Youth Charter Hustlers, which is an advocacy group that will lead that kind of advocacy. But I think there are many other advocacy entry points that we can work together around, especially socioeconomic recovery from this. So this is more or less, I think, the three phases that we could build advocacy or action or immediate support for youth moving forward. But since this will wrap up in just 1 minute, this will close. I think this is just a start of a conversation. We'll share with you the report from this, the country experiences and different expertise that have been shared. Some of the suggestions, and then maybe we work for like 3 or 4 days online on refining this kind of document, and then we can have a follow-up call if agreeable by everyone. Literally have 1 minute.
I am happy with that, Aya.
Okay, cool.
Sounds good.
Sounds good.
Aya. Thank you.
Okay, have 1 minute. I just wanna wish you all to be safe, and you and your loved ones, and to take care of yourselves, your mental health especially, and we are here to support each other. So I hope that we all check on each other and keep on being sisters for each other. This is my last words, and if anyone else wants to jump in before this is closed.
Yeah, no, I learned a lot from everybody. Thank you so much. God bless all of you guys.
Thank you, ladies. Well done.